Hello, everyone. Welcome to the International Interprofessional Mentorship meeting. I am Dr. Kate Barlow, the founder of the program and your host for today's meeting. It's February 9th, 2021. And today, Dr. Valerie Strange is here to talk about cardboard carpentry. Please mute yourselves during the presentation and unmute yourself whenever you would like to ask a question. You can also type your questions into the chat box and I will ask the questions for you. In order to receive a certificate of attendance, please enter your name and email into the chat box now, and you will need to remain on the webinar until the presenter is finished. At the end of today's presentation, we will have an optional meet and greet. Thank you all for coming today, and let's get started. Thank you, Val, so much for coming.
Thank you so much for having me. I'm super excited to be here. And you know, when I was asked to do this cardboard carpentry kind of 101, I was saying, you know, it's how am I going to do it in a manner that you come away with feeling like you have ideas, because it's this hands-on thing that you need to do. So I'm really going to be looking at, so in terms of learning objectives, I want to talk to you from kind of two hats. One hat is my role as a professor, and when Dr. Barlow asked me to present, it was based on a presentation that my students had done for our State Occupational Therapy Association. But then as I was thinking about it, I also have another hat, and that's my role with student engagement and international travel, which is how I got involved in cardboard carpentry. So back in 2013, I started going to Nicaragua. Between Nicaragua and Guatemala, where we have community partners. So I kind of dove right into cardboard carpentry as a result of that. So I'll be speaking kind of from both of those hats. I'm hopeful that I'm going to just share this person-centered focus that we use with our students that help guide them. And certainly as therapists, you don't need this, but I wanted to just share that hat on how we help our students understand the use of adaptive technology using kind of a human activity assistive technology model. I'll give you a brief understanding of the 6 principles of cardboard carpentry as it relates to adaptive design, which is based out of New York City. And I'll explain the basics of cardboard that are essential for building structures with lots of visuals. And then through the case studies and additional sample slides that I've added, just have an opportunity to reflect on the possibilities for adopting this approach if you haven't already been doing this. So when we're teaching our students, we really start out with helping them understand what does it mean to use, secure, modify assistive technology. And in our focus with cardboard carpentry, the underlying features here is that we're looking to increase, maintain, or improve function of individuals with disabilities, children and adults. So my question to you all is, can you share how you've used assistive or adaptive technology in your settings, or what types of adaptations have you made or that you want to make that you haven't had an opportunity to? Is there anyone that has experience with adaptive technology, or is this new?
Can I talk?
Yes, Mary. Yes, thank you.
Just wondering, I think it's what we call here the paper-based technology, a PBT. Is that so?
PPT as in?
A PBT. It's like paper-based technology. So we make like sitting aids with cardboards and papers and newspapers, something like that.
Yes, that's exactly what this is. That's exactly what this is. So thank you. I appreciate it, because as I'm talking, even you sharing some of the strategies that you use would be very helpful. So thank you.
I also wanted to say something.
Yes, please.
Yes. I had the first-hand experience in paper-based technology too, but it was back in 2005. I was still a student in the Diploma School of Occupational Therapy. So we were exposed to the making of paper mache using, like she said, corner seats for children with cerebral palsy. And that was all we could learn then as students. We made stools too for in the mental health department too, stools and other things we were helping patients with. So that was the little I could say concerning the paper-based technology.
That's excellent. And Emmanuel, if I can ask, have you carried that over into your current practice, or do you need to create these types of things?
I would need to have more experience in the paper-based technology, and because I double as both a lecturer in the School of Occupational Therapy and also a clinician occupational therapist in the psychiatric hospital. So that's why this seminar it's important for me because one of the things is that there's more versatility in my program in the sense that I take a lot of courses, both pediatrics, mental health, group process. So because of shorthand in occupational therapy, so we need more hands. So right now I dig into almost everything. So that's I'm going to learn from this.
That I appreciate.
I'm looking forward to learning and also introducing to my students so we can, yes, make it work out.
Yes, and that's where I'm excited because you have those same two hats. So you want to be able to teach the students the proper way to do it, but then you also want to be able to have your own practice and then make a difference with bringing it out into your practice. So that's why I wanted to start with using this hat model so that the students understand. Here, as well as I believe anywhere, it's so important to understand the person. So as an occupational therapist, the idea with this model is that the focus is actually on that person who is doing something. And then we look to see where there might be challenges. And then we look at the technology to support that doing. So again, it's increasing participation, but also it's how do we make technology work so that the user wants to continue using it? So HAT, just what the model, the acronym is human, the activity, the assistive technology, but most important, it's knowing where and when and who with that person might be using that technology. So our students are asked to troubleshoot. So I had run a course, and this was how this came about. We have a course here called Special Topics. And in this Special Topics course, we had about 15 university students who learned how to do cardboard carpentry. And we met with high school students who were in a transition program. And this transition program is designed to teach independent living skills before students leave high school. So many of these individuals had some physical limitations that were preventing them from being independent. So we were able to take this class, bring in people, and my students, OT students, were able to evaluate using this process. I wanted to do a little shout out for the history of cardboard carpentry as I'm providing this information. And it's all been based on what I've learned through adaptive design and my practice. And how it did begin with a woman named Alex Truesdale in 1981. And she really this woman looked at how individuals didn't have an opportunity to participate. They might not have access to equipment. And she wanted to do something about that. So in her work, she then founded this adaptive design program in New York City. And it started out as this small workshop, and I've given you information at the end of this presentation so that you could see just how much they have grown and how much their goal is to share as much information as they can so that we are all doing cardboard carpentry. And back to David's comment, I found this site that showed this manual training on cardboard construction from 1907. So we know that this has been a process that's been going on for a very long time. And again, I'm always interested in the documentation and literature around it. So Adaptive Design is a nonprofit organization. And the idea was that if we teach how to use cardboard carpentry, it's a way to be cost effective when making adaptations for people with disabilities. So they, again, have education and internships. They take people, people come for internships for months at a time, a year at a time. And they really are now expanding and looking to continue to develop partnerships. So I've included some of the network programs that I recently found on their website. So to me, you know, I traveled to Guatemala. I had no idea that there was a partnership there. Now I need to know how the proximity, but for me, that's an opportunity to then see how we can expand the use in the areas there that we typically make designs for when we're there, right? So who else can carry this out when we're not there? So in terms of adaptive design, there are 6 principles of fabrication, and this is what we teach our students. So one, it has to be safe. I'll show you a case study of a young man who had a rear-facing walker, and he needed an adaptation to the walker that was non-existent. But we had to help the students understand that when you're evaluating to add a piece of equipment onto a walker that's commercially made, we want to make sure that there aren't issues with warranty, that there aren't issues with liability. You can't put something on the side of this walker because it becomes wobbly. So that safety is important, that it's needed, meaning the user wants it, and we've helped the user identify specific ways that they could use it. Gotta look good. That is something that is near and dear to the philosophy of adaptive design. Needs to be durable, right? So you talk to people who don't know about cardboard carpentry, they say, how does cardboard carpentry last? And with the principles of the design, it is durable. It's lightweight, yet you can create a chair with the right reinforcement that could hold 500 pounds. And the other thing is that it's made with eco-responsible materials, locally available, and low cost, okay? These are just a couple of quick pictures of some of the designs that were created for the students in our program. So on the left is a typical wedge, very easy to create. This electric chair had a sunken seat, so we needed to lift it up for the student. This student had significant contractures, so we needed to increase the angle and the height by which he's able to type, which increased his independence. Remember I said it needs to look good? This picture here was painted by the user. So in order for us to feel and for him to feel as though it looked good and that he wanted it, we made him a part of it. So those were the colors that he chose. So I'll be talking to you about the specifics of the materials. I would also like to add that, nope, I'll save that. I'll save it. I'll see when you all figure it out. So quickly, basics of cardboard. When we're using cardboard, there's either a grain, which is the weight-bearing edge, or the stacked edge, or the rougher side. So those are two very important principles, right? One allows you to use it as a weight-bearing surface. The other allows you to bend it in different ways that enable you to create larger pieces of equipment. The next slides will give you some examples and visuals of these basics, right? Once you know about the cardboard, you then need to cut it, bend it, know how to join it, know how to reinforce it, and know how to edge it and finish it, right? Edging it for, well, look, but also for functionality, and finishing it so that we can seal our work. Materials used. Commercial triple wall cardboard is what we use. It's not the same as the box. So when we travel, we actually bring the cardboard with us. However, if you do not have access to or affordability for this type of cardboard, you can glue layers of single wall cardboard, like a box that you might have, and then you cross the grains so that you increase the strength, right? So these are the logistics of it. In the end of the presentation, I have included videos from the Adaptive Design website that take you through each of those processes that I mentioned in that first slide on basics of cardboard. So once we're done with identifying the cardboard, reinforcing and making cardboard thicker, if you don't have the tri-wall, we need to be able to cut it. So when we travel, we use the materials that are available to us. Basically, a steak knife and a utility knife work well with practice. Bandsaw, jigsaw, if anybody has access to those, it tends to make the process quicker. When we were in Nicaragua, we had a family member who did have tools that he allowed us to use. But oftentimes, it's teaching our students how to safely and efficiently use a steak knife or a utility knife. Bending. When you bend the materials, it is so easy to do with a ruler, the bottom end of a spoon, and your pencil. So one of the things then, once you have it, again, where am I going to bend it? So if I'm going to make a seat insert, I want a seat, bend it into a foot box. Then I want to have a long piece of cardboard. And again, there are, you draw your line, you use your ruler, you edge it with the spoon, and there's a little snapping that goes along to bend. Joining. Once you decide on something that you're going to make, we'll just say that, so we use a glue gun or glue sticks, okay? The glue guns have been really helpful to use because when you join and apply pressure to the joints, it takes about a minute to harden. If you don't have that, white glue works, a plastic card or credit card type thing that you can spread the glue, and then weights and plywood, but then you have to let it sit overnight in order for it to harden, okay? Reinforcing. So in this picture, what you saw here, so here the glue gun was used in order to join those two pieces. In terms of reinforcing, we're using wooden dowels, an awl, or a Phillips head screwdriver, you know, the one with the pointy end to make holes, and white glue. And what you'll see here is that the dowels are cut to about 3/8 of it, 2.5 inches. And we sharpen them. We put a hole where we want to reinforce, and then we hammer those wooden nails in. So the descriptions are here as well. We use a pencil sharpener to actually sharpen the edges of the dowels. When we're in our community sites, the children of the neighborhoods are so thoughtful in wanting to help us. We could have 5 children sitting along a sidewalk or the street sharpening our dowels for us so that everybody gets along. And the reason, and the sharpening is important, and I'll show you later, because you could use the sawdust from that to fill any holes. I tend to still have holes and separations because I've only been doing it for about 4, 5, 6 years, and I still need practice. Edging. So when the cardboard has the openings, we saw the grain and that kind of fluted edge, you want to cover those up. And adaptive design supports the really using eco-friendly, eco-conscious materials. So paper, heavy paper, and you use this heavy paper to seal and strengthen, and it prepares for finishing. No holes, no open areas. Heavy paper can be anything from craft paper to, I've used paper bags, to magazines, to masking tape. Okay, so those are still considered eco-friendly products and paper products. When traveling, what you may have noticed in the first samples of photos is that we used duct tape and contact paper. So I will say that that is not part of the 6 principles of adaptive design, but it's something that when we were traveling and we're only in a location for 10 days, it's quicker to do than waiting for these things to dry. But it's a beautiful process to use the paper as well. For finishing, the reason that we finish is obviously to make the structure last, harden the surface, make it water resistant, and you do this by layering with a water-based primer, a water-based latex paint, and then urethane, which we typically use to seal hardwood. So in that first slant board with those beautiful pastel colors, our client was able to work with those water-based paints. Can't use oil. Oil is an irritant, right? So the oil-based primers and paint, they're irritant. If it were to chip, it's harmful if swallowed, so it's always water-based, right? So that's honestly, those are the 6 features that you practice with small pieces of cardboard to be on your way with feeling comfortable with manipulating. Should I pause? I see there are chats. I'm happy to take any questions. Okay, I just noticed, okay. So I'm going to share some case studies. The first 2 case studies are showing you how our students at the university evaluated the individuals that required some of this adaptive technology. So in the first case study, using the HAT worksheet, the model, the human was a young man, 20 years old, who had has cerebral palsy. He ambulates with a rear-facing K-walker. He can express himself verbally. He requests help as he needs it. He is a good problem solver. And he's motivated to complete his occupations independently. At the time, he had peers at the university that he would have lunch with. However, he had to have an instructional assistant or a job coach get his lunch, carry his tray, bring it to the counter for payment, and then walk it to the table. And that was something that he no longer wanted to do. He's 20 years old. He was interning in an office, loved his job, could not move the files from one place to another, which was a big part of his responsibility because he required his hands on the walker all the time. So that's who he was, very briefly. Beautiful young man. I'll show you what we did. The activity, as I said, is he had difficulty with reaching and carrying during those times. It also affected his ability to be independent at home. And he and his family were really working towards getting him more independent in the hopes that he could then move out of the house. So the technology was a rear-facing lap tray. The student said, that's it, we're making a lap tray that we can put behind his walker so that he can now carry whatever he needs to carry. So that is what they did, and I'll show you their process. And there was none available on the market. And there were no templates available to us from Adaptive Design. However, Susan Friddy, an occupational therapist extraordinaire who works at Adaptive Design, really helped us problem solve what we were looking for in the process. So again, I said that HAT model really looks at context. So where is he going to use it? Work, school, and at home. And how supportive were his social contexts, right? How willing was he to use it with his friends? How willing was the family to be able to support this? So this was the dialogue that our students had with this young man. And because our students were similar in age, it was very easy for him to work with them. He enjoyed his time. So this was his walker. And it's hard to tell, but it's this piece, excuse me, not that piece, that's his seat that's been lifted up. So the seat is typically not in the way. We needed to create a lap tray here. We had the bottom piece that was brilliant because we were able to use PVC pipe to support it, as you know, and the weight. So trial and error, we got pieces of PVC pipe and we created the support, which this is upside down. These pieces were attached to this bottom part, and then the lap tray came across the back. Okay, so you could see our student attaching the PVC piping. She then took 3 layers of triple wall cardboard and glued them together after measuring the size of the lap tray that was needed. And then we were able to cut out the area that the PVC piping had to fit in. This young man was part of the process, part of the design, and it was a wonderful opportunity for him to value the equipment that was being made. So here's another look at that same lap tray, which now you take a long rectangular piece and you do the bending and the joining and the reinforcing so that there is a lip, so that things don't slide off when he's traveling. I talked with you about holes and gaps. This was their first attempt, and it was a beautiful attempt, but there were some kind of gaps in the lap tray. So they took the shavings and there's also a video that shows you how to do this as well. But the shavings from the pencil sharpener and any of the kind of sawdust from cutting the cardboard used white glue to fill in the gaps. This is a photo of our young man painting. He wanted it red. He had to have it red. So he worked on it. We finished it up here. They're actually polyurethaning it now that it's done. This is the before and this is the after. If you'll notice, he also did not want the PVC piping to be white. So we were able to spray paint it silver to match his walker. He did need assistance to remove the tray, and that was something that he was going to continue to work on. So his family had a van, a larger vehicle, so they were able to put it in and take it in and out. But again, that's something to consider when making recommendations like that. So here again is his tray. Here he is after carrying items over to his workspace to be able to do his work. Here he is in we have a model apartment at our university, and he's doing homemaking skills using his lap tray. So needless to say, our university students said, I get this, I really like this idea. Next example is a student who had a difficult time sitting comfortably in her classroom setting. So she is someone who tended to sit hunched forward with her legs crisscross in the chair. She would not put her feet down. Typically the chairs were too tall for her. And she used the back of the chairs to really hunch forward. So in your resources, I gave you a template, and you'll see the template in the next slide to make a perch chair. And this perch chair was angled. It was designed tall enough so that she could sit up, but her feet could still hit the floor. It was slanted so that when she faced forward, we tried to encourage more upright versus hunching forward. She also participated in the process, as you can see here. This is the making of the perch chair, right? It'll, again, takes practice. How good are you at measuring the size of the person? But then knowing you're going to learn that when you bend cardboard, it's going to shorten it a little bit. So you practice. But basically, it is a long rectangular piece that accounts for wrapping around. Then there are 4 support panels. Anytime you create a box that somebody's going to weight bear, you add panels inside to reinforce it. So this is the piece. You use the bending technique. You add the reinforcers. You add the support panels. You join them with the glue. You reinforce them with the wooden dowels. And you continue that process as you're folding it. So again, I'm going to join, I'm going to reinforce, and then you roll it over. This happened to be a rocking perch, which was very nice to help her have some movement without having to get up. So this is typically what the templates look like that you have. This is the creation in action. And again, you know, the student, this was their first time. So they went through the process the first week or so where we did the technique so that they could understand how to use the supplies and the materials. They made a very small item and then they went to work. Some folks had to use additional cardboard, but that was okay. Handles were cut into it so that it's easy to pick up. Here is her finished product. This seat was a little high for her, but what we noted was when she was in her classroom, her feet were down. She was sitting up more upright. She does have this kyphosis, so that certainly had remained. It's more fixed, but it was nice to see that she was comfortable sitting in a manner that supported her. So now I'm going to flip. I'm going to give you examples of the things that some of the things that we've made when we're abroad, when we're in Nicaragua or Guatemala. This was a chair insert, and all this entailed this was a child who family had very little furniture. These were the pieces of furniture that were in the living room area, and the child had to be held all the time. So the family really wanted an opportunity for this child to be able to sit in place. Unfortunately, I don't have the picture to show you the child, but again, this is a long piece of rectangular cardboard that we bended in these two places. We had 4 additional rectangular pieces to act as a foot box, so this child's feet would not cross, and they would be able to plant their feet to be able to provide better trunk support and upper body control. Again, we used contact paper and duct tape and Velcro to hold it on. So I just want to point that out there, that it's, certainly not following the principles per se. This is how we adapted it in order to do things quickly. We visited pediatric clinics where equipment and materials were hard to come by. So the therapists looking for opportunities to work with their children in prone. This is not one of our children. This came from a magazine of supplies. So I don't want you to think that I'm showing somebody that's not already out in the public in a magazine. Commercial wedge, and this is a homemade wedge. Use of towels, etc. Now that I look at this, what I really think we should have done was added another box here so that we didn't need the towels, so that this child could then have a box to rest their forearms on and to be able to pick that toy up onto the box. So I think, my remark, making that remark, just shows how you have a different perspective the more you work with these materials and to make it better. Side liar. Mary, you have a question.
On the previous one, on the wedge, you said it was for the center, or it is for this particular child that is on it, on the wedge?
Oh, the wedge, I'm so sorry. This was this was a child that we were working with here.
Okay. So it's for particularly for her?
Yes, particularly for her. So the length of the wedge was important based on the length of her trunk and lower extremities, so that we could try and get some extension at her hips.
Okay.
And again, I look at this and I'm going to say, had we had more time, I would have liked to see that we added a box. It's nice that we have her bearing weight through her forearms, but if I want her to keep and her head is up, but if I want her to keep her head up because she's engaging with a toy, I want her to have access to that toy, which she doesn't have right there. So this was in the evaluation process. And that's how you use your therapy skills to identify what's needed, This was a creation of a side liar, commercial side liar, very beneficial, right? To nice tone reducing posture, provides the child's ability to bring their hands to their visual line of sight. gravity eliminated or assisted so that it's easier to move our hands, not available. So in making, we made a side lier to enable that child to be in that side lying position. If you look, this is basically a large piece of cardboard whose width is the length of the child or a little more, bent 2 times. And then we have additional cardboard reinforced underneath so that we're able to make that fold happen and support it. Not the prettiest thing, but functional. It needs to look good. This was what worked at the time. And again, I think there's lots of opportunity to make it look good. But again, we want to be able to use our skills to create those opportunities for positional changes where needed. David, I think you mentioned corner chairs, or Emmanuel, I think you mentioned you've made corner chairs. Is that right?
I think Emmanuel did mention it, but I've also made them.
Yeah, so
Yes,
these,
I mentioned corner seats
yes,
for children with cerebral palsy. Yes.
that you've made for children with cerebral palsy, you said?
Yes, yes.
Okay.
We made corner seats, yes.
Okay. Getting the measurements is one thing, right? So the first time I've made a corner seat, I made it too big. So am I going to put in my towel rolls or whatever else I need as the child grows into it? Probably. But again, you look at the pieces of cardboard that are needed. This is one piece of cardboard that is bent in 2 places, certainly cut out, as well as the piece on the bottom. You could see how the masking tape is used. You you tear them into small pieces and really provide pressure as you're securing it in the spot. This way, we're preparing for finishing. So again, here are our commercial, and here is the non-commercial. I have not made stairs, but I am stairs like this. I have made stairs. We've actually made stairs for our students who come to our transition program, right? I said learning to be independent with life skills, work preparation skills, who work in our library who can't reach the top shelf. So we have made stairs for those children. Here's the use of PVC piping. This I have not made, but again, it's a matter of once you learn how to make a structure, you can adapt it based on the needs that you have. So that's kind of to give you a visual as well in terms of, yeah, I might need to do this. So I need to have a box. How many pieces do I need? Well, this it could be one piece of cardboard bent 1, 2, 3 times, or 4 times if you've got it over the bottom. So 1 bend, 2 bend, 3 bend, 4 bend. And then you make this kind of L shape to go on either side. And then you have 2 or 3 additional L-shaped pieces to reinforce the center for weight bearing. As a reminder, remember the grain is that kind of triangular open side. That's your weight bearing side. So again, you go back to that original principle that's where I want to have it. If you use the fluted side, it's going to bend, so it won't weight bear. So all of the resources that I have used have truly come from adaptive design, with some of the modifications that we've used for speed or time. But I wanted to share this with you all.
Sorry.
Yes.
I have a question.
Yes.
So I'm concerned about how you do your finishing to make the aesthetic look nice. Do you use painting, or you use there's a technique that you use to do finishing?
Yeah, so when we worked with our students in the United States, we did the finishing with the water-based primer, the water-based latex paint, and then the polyurethane. If you do the water-based primer, you need to wait about an hour for that to dry. When you do the water-based paint, latex paint, you have to wait about 2 hours for that to dry. And then you do the polyurethane, and that also is minimally about 2 hours to dry. That's the way to do it so that it is aesthetically pleasing, and it is part of the process that adaptive design uses. You saw that some of ours were, we did not do that finishing. Instead, we would use the contact paper, which sticks, and duct tape. In spreading the contact paper, we would then use that plastic card again, you know, so I might take a card like this and really kind of apply pressure so that we could apply the contact paper so there are no bumps. So I kind of described two processes. Did that answer your question?
Yeah.
Okay, thank you.
Because I was thinking also we could use the oil paints.
Yeah, so the thing with oil paint that you want, so I think it's going to depend on your product. The recommendation is not to use oil-based paints because they can be irritating on the skin. I'm sure once they dry and you put polyurethane on it, that could be not an issue. If it were to chip away, swallowing it is not healthy. So those are the things that you would want to think about when deciding that you'd use that kind of a paint.
Sure.
Okay. So I spoke quickly, but all that I showed you in the photos, so building with cardboard, those materials, this is a booklet that shows you the photos of all of the tips on how to do those 6 basic principles, or those 6 skills once you have your cardboard. So those videos, this is the template for that. These are the videos that show you some of the tips and tricks. They're short. They might be 1.5 minutes or 57 seconds to show you bending techniques. And same with this video learning library. I thought I had more on the PVC, but I guess I didn't. So I included the kind of all about PVC. It is not cardboard carpentry, but if you have access to PVC piping, I added some resources here that could get you started. We've made commodes. We've made walkers with cloth. So if somebody needs a walker but also needs to sit, or just made walkers, we've made parallel bars out of PVC. So, and then the last resource here, or not the last resource, U-line shipping. You know, again, if materials are very hard to come by, this is not a great resource. If for some reason you're at a university and you have, you know, applying for a grant to get your program started, this is an option to consider. They ship the tri-wall cardboard.
Yeah, we have a question in the chat box.
Yes.
Mary was wondering, how do you ensure stability on the sitting aid?
So ensuring stability on the sitting aid. So with that, is this what you're speaking to, Mary?
Yes.
Okay, so yes, so this was the start process. One of the additional things that you can do, depending on the child, is to then add a lap tray. So like that walker, we could look at putting a lap tray together for this child. So I might take layers of that cardboard, do a cutout where the arms are for this seat, and then have some kind of a strap around the back. Again, it's going to depend on what the needs are. If that child needs to have freedom to leave that seating position, we want to be careful about restraining. So again, we would assess that. So you're right, there is not a lot of support for the upper body. The hope with starting with this is, so we want to be able to see that we can look at the pelvis and hips and see if we can get those aligned with a nice firm surface. So that's kind of my first thought process. And then if we can get this child to bring his legs down so that his knees are flexed, his feet are flat and not dangling, that would also provide support. Then my process would be to look at what's happening at his trunk. So actually, now that you and I are problem solving, I might add, if the seat was deep enough, I might add a piece of cardboard to the back and then join lateral supports at the chest. And that's how I would evaluate. So it's kind of this one piece at a time, but you're absolutely right.
We have another question. Kigali was wondering if you've tried to make a standing frame.
Yes, yes. Listen, so standing frames I have made with other people. I have not done it on my own. But there are a few ways that you could do standing frames. And the first one that comes to mind, which is in my wheelhouse, is anybody familiar with the book Disabled Village Children? That book is tremendous. And your question in the chat made me think of it, because in rural areas where it's difficult to have any furniture, Disabled Village Children pictures show standing frames that are literally either pieces of plywood, or you could do it with cardboard reinforced so that it's on an angle up against a table that is secured. And then you add strapping, at the trunk, the pelvis, etc. Other standing frames that I've assisted with start as the box or the three-sided. And I can certainly get a template for you, and I would recommend practicing with it. It's been a long time since I've done it, but yes, you can make standing frames, beautiful standing frames. David, have you made standing frames?
I have not made a standing frame. No, I have not.
Yeah,
But I've
yeah.
seen them made.
So I am happy to search through my things to find photos for you, because again, pictures sometimes speak louder than words, and find the template for you for standers.
But as Kate has said, you can download that book for free off the internet.
And I will send out the link to everyone
Oh.
to the book. I require my students to read one of the chapters in it, and then they have access. So I will send the link to everyone with this recording. They were also in the chat box, they were also saying that they use cassava flour for gluing and stacking the newspapers for designing. And a bunch of people were commenting that they use the same. And then someone else, Mary, uses wheat flour.
Oh, that's phenomenal. So, I think of allergies here with wheat, but that, that's either here nor there, but it's cassava, because I have the tortillas made of cassava flour, but that's interesting. That's good to know. So again, that's a beautiful strategy that would be helpful, especially when, we're not able to get Elmer's glue or white glue. And if it is reinforcing, that's phenomenal. So thank you.
In Uganda, in the villages, there were some people I was working on make furniture, and they would first make cornmeal, basically a cornmeal like polenta, and then afterwards they would scrape the rest of the pot and use that to make some of the glue.
And it lasts.
Yeah.
Do you have to finish it? Are you able to finish, because it's gritty, right?
Not the cassava is not gritty. Sometimes the cornmeal can be gritty.
Okay, okay.
And the wheat flour is not gritty.
See, I hope to keep in touch with all of you because you're sharing incredible ideas.
So we have one more question. Victor was wondering, do you have a photo for the bar frame? Were you talking about the parallel bars, Victor? Is that what you mean by the bar frame?
If it's for the parallel bars, I don't have a picture, but I could get a picture. And I also believe that there are photos in Disabled Village Children that also show how to make parallel bars. Yes, the parallel bar.
Yeah.
Yeah, so I'll search for that too.
Great. All right. Any last questions for Val before we end her presentation? If you don't, if you think of one after, which it's like the doctor's office, you always think of it after you leave, you can always email me and I can forward them on to her if you think of questions later on.
Wonderful. And I also included my email on the presentation. So do feel free to reach out to me as well. It's incredible to make connections and to learn so much from different perspectives, as well as in terms of supplies that are user-friendly for all of these areas. So thank you so much. I appreciate your time.
Thank you so much for coming. This was wonderful.